I'm going to share my screen here with everybody. So I've just gone to a view where you can see I'm on the exceptionallivingcenters.com webpage. And I wanted to point out that on this page, we've got a link to COVID-19 resources that I'm clicking on right now. Link to that, we've got also COVID-19 vaccine FAQ, which looks like this. This was something we put together when we did our town halls a couple months ago. We've also got the CMS mandate FAQ that looks like this, 11 pages of questions on the new emergency regulation that came out last week. We also have the Zoom links to today's town halls, which will be over here in a little bit after this last one. We've got our doc talk videos from the ELC talk with the doc about vaccine and Q&A related to the vaccines. We've also got a recorded virtual staff town hall from August 27th. So quite a few resources on the ELC homepage. So I'm going to be navigating here today for those of you who can see this and just be able to sort of provide some visual aids to the discussion today. But before we get started, I just want to thank everyone for zooming in, dialing in, or however you got here. So thank you. I think this is an effective way for us to communicate. Maybe I should say a more effective way than me simply just sending an email out to all of our executive directors and asking them to communicate down to the team, or to just simply send an email blast to everyone with an email. I know we did communicate some information last Friday that way, but I think this is a little bit more effective. So thank you. Before I jump into the content of today, which obviously is the new CMS emergency regulation, I just want to start with what I think is an obvious statement, but I think it's an important one, that Exceptional Living Centers supports the use of COVID vaccines to reduce the risk of contracting COVID-19. We do continue to respectfully request that all employees who can get the COVID vaccine do so as soon as possible. Obviously, that would make this discussion about the new CMS requirement much easier for all of us if that were the case, and would eliminate concerns about moving forward, with the exception of obviously just compliance issues with ongoing CMS requirements. So having said that, I want to backtrack a little bit and remind everyone that an initial announcement regarding the COVID vaccine requirement for facilities regulated under Medicare conditions of participation was made August 18th. At that time, we created a series of virtual town halls on August 25th, 26th, and 27th in an effort to communicate everything we knew at that time about the announced COVID vaccine requirement. The problem was, at that time, we really did not have a lot of specific information. So as I click over here to the COVID-19 vaccine FAQs, these were compiled at that time, and you can see they've been updated already to reflect the latest information from the emergency regulation. But we had these town halls, and we wanted to come and tell all of our employees what we knew, and we really didn't even know the deadline at that time. So that was unfortunate, but really felt strongly that when we get information like, hey, you're going to have to abide by a vaccine requirement, we felt like that was important to come to this sort of a channel and communicate that with everyone. So, frankly, I was starting to wonder when or if we would ever see this rule. August 25th was a long time ago, almost 75 days ago. And so now here we are. So I'm a little bit relieved that the rule has come out, but also obviously a little bit stressed about moving forward and complying with the CMS rule that was issued. So I've clicked over here to a PowerPoint presentation. You can see this is on a cms.gov website, and is a CMS issued presentation. And so what I'll do to begin with is scroll down here to to page 6, and I'll address a couple of the frequently asked questions from our last virtual town halls to go ahead and address some of the common questions that we had then. You'll see this is sort of the headline news slide right here, that each eligible employee must receive their first dose of the vaccine by December 6th of 2021 and must receive all shots or full vaccination by January 4th of 2022. So this requirement is not just a requirement to get fully vaccinated by January 4th. It's a little more nuanced than that, in that, after December 6th, we will need to evaluate who has not had their first dose of the vaccine, and those who have not won't be in compliance with the rule, and we'll need to address those at that time, which the most common way will be through a voluntary termination from the company. So there's some serious consequences here for not falling into compliance with the CMS reg or CMS Emergency Regulation that was handed down. Now, I want to address another common question, which was, what does it mean to be fully vaccinated? And you'll see here on slide 8 that CMS considers staff fully vaccinated if it has been 2 weeks or more since they completed a primary vaccination series for COVID-19. So I think that's pretty common, for all of us who work in healthcare. We all know that, the vaccination, the COVID vaccine is more effective or is taken full effect within 2 weeks after your second dose. But it's important to note that for purposes of compliance with this rule, staff who have completed the primary series for the vaccine received by the phase 2 implementation date, January 4th here, will be considered to have met these requirements, even if they have not completed the 14-day waiting period. So they're giving a little bit of grace here for those who get their first dose by December 6th. Maybe if you get your second dose on January 3rd, you don't have to wait 2 weeks to be in compliance, is really what this little exception says. So there is that. Another common question that we hear is a question about booster shots. The simple answer to, are boosters included in this vaccine requirement? The short answer is no. So that's nice. We don't need to worry about the additional complexity of boosters for this vaccine or that vaccine, or when did you get your booster, or when do you need to get your booster to stay in compliance. That we've simplified the obligations in some respect. The longer answer I feel compelled just to share with everyone is that CMS does strongly encourage facilities and staff to review the CDC's interim clinical considerations for use of COVID-19 vaccines. I don't mind to tell you, I've had my booster, really was no different than the vaccine. So, but nonetheless, it is nice to not have to worry about boosters for purposes of this discussion and our facilities and our employees' compliance. Now, I think that, one of the more involved discussions here about the COVID requirement from CMS are medical and religious exemptions. I want to stop before I jump into this. I want to explain a couple things. We talked about medical and religious exemptions on the last town hall, and we requested that employees who wanted to apply for those exemptions go ahead and submit those applications to Human Resources at Exceptional Living Centers. This is the COVID-19 vaccine FAQ from our last town hall. This is some information about content of these applications, what you should include to help us process those. I must admit, I think we were sort of feeling around in the dark to try and see if we could get the right information. But frankly, at that time, much like we did not know the deadline and we did not know the specifics about the vaccine requirement, we really didn't know the specifics about what we would be able to approve in terms of medical and religious exemptions. And I'll walk everyone through what I mean by that. I think it'll make more sense once we've gone through the details. But I want to apologize to everyone who has submitted those applications for exemptions. I know everyone's anxious to get some feedback on those, and I want to thank you for submitting the information in advance. I feel like we're all in a little better place right now to move on these quickly, but I also know that everyone's anxious to get feedback, and we've been waiting. And unfortunately, we felt like we needed to wait to get the rule in writing and evaluate it and process the exemption applications properly. But I know it's been a little bit stressful, and just want to appreciate and say thank you to everyone for their patience. So back to just the content of the exemptions. I want to scroll down here where we get down to CMS slide 10. And it talks about how do accommodations work. And just to connect the dots here, it's important to know that any employee under the ADA, the Americans with Disabilities Act, I'm sorry, and under the Civil Rights, I think it's Title VII of the Civil Rights Act of 1964, every employee has the right to apply for a medical exemption or a religious exemption for a sincerely held religious belief. Those applications may be for any rule or policy or that the company may have. And what you are requesting under those two federal laws is some form of accommodation from your employer. And sometimes those accommodations can be reasonably afforded, and sometimes they cannot. So CMS is offering us some guidance here that some potential accommodations for exempted staff, I'm looking at bullet point 2 here, could include, but is not limited to, testing, physical distancing, and source control. In other words, if we have an employee that qualifies for an exemption, and as an employer, we are considering whether or not we can afford them a reasonable accommodation, some tactics that we can use could include, this is your basic COVID toolbox, just short of a COVID vaccine, right? Testing more frequently, physical distancing, and source control is another way of saying masking. We're going to wear masks. So you'll notice, while that's the case, we also get from CMS this sort of little warning shot in all italics with some underlines that in all cases, facilities must ensure that they minimize the risk of transmission of COVID-19 to at-risk individuals. And so I'll point out that, again, I'm on a CMS website. I'm reading a CMS slide deck that's really more directed towards facilities that are required to be in compliance than it's meant to be directed towards an individual employee. And it's our company's interpretation that CMS essentially what they've made very clear, frankly, in several webinars and other communications meant to make the rule very clear, is that the facility needs to take responsibility for ensuring that any accommodation we make, that we're ensuring that we minimize the risk of transmission of COVID-19, which probably is not surprising to any of us. I think we all understand that's our responsibility. So as we anticipate reviewing applications for medical and religious exemptions, we've had to evaluate the tasks that are performed in a facility every day, the job titles and the roles, and which of those job titles and roles can be filled by individuals who qualify for a medical or religious exemption. And those job titles are as follows: food service director, food service assistant, cook, MDS coordinator, medical records, central supply clerk, business office manager, assistant business office manager, HR specialist, HR payroll. These are all job titles that don't come in routine direct contact with residents and coworkers. I'm going to pause here for a minute and ask Angie Sutton if you could chime in a little bit about what we mean by that and how the concept of routine direct contact helps us to evaluate and reach a conclusion about how we are effectively minimizing the risk of transmission of COVID-19 while still affording reasonable accommodation to our employees that qualify for exemptions.
Yeah, absolutely. Our goal is really to reflect and not to repeat one more time what Tom just said, but I think it's really important as we process that information. Our obligation is resident and coworker safety first and foremost, and CMS has charged us with ensuring that we're minimizing that risk of transmission. And we do feel like there are certain roles within the center where that have very intimate, close connections and consistent connections with residents. We know our nurses and CNAs are sometimes less than 6 or 8 inches in providing direct care and routinely throughout the day, interfacing with our residents, where other roles have the opportunity to be very supportive of the resident care process, but not directly in the face of a resident or within an arm's reach of resident for an extended period of time. So there's those roles that where the physical distancing and the source control, we can have some predictable routine analysis and kind of watching and making sure that if I'm a business office manager, I can sit 6 feet apart from a resident, and I'm not doing that at all times of the day, where maybe if I'm a nurse or an aide or a therapist or activities person or social service person, my goal is and most of my day is to be spent right in front of a resident, dealing with a resident, supporting a resident and caring for. So we really are working to recognize that some roles have more intimate connection, both from a space standpoint and from a frequency standpoint, than other roles within our center.
Perfect. Thank you, Angie. I appreciate that. So just to state the obvious, then, when our surveyors enter the building, for example, we'll go over later in this slide deck. It points out that this rule will be enforced via complaint surveys and annual surveys, or if you might imagine someday in the future, if we had an unfortunate some breakthrough infections of COVID-19, or we had 3 or 5 or 6 positive residents, there could be a complaint survey focusing on infection control or other parts of our business that would absolutely include the evaluation of accommodations that the facility has afforded to employees that qualify for an exemption, and is the facility ensuring that we're minimizing the risk of transmission of COVID-19. So obviously, when we think about the future of surveys and long-term care, we're going to have an obligation to demonstrate that and to deliver on making sure that our potentially exempt and unvaccinated staff are essentially testing more frequently, they're distancing themselves from our residents, and we're masking, and that we can demonstrate that. And I think we've all seen plenty of examples of that through surveys and infection control surveys over the last 20 months to have a good idea of what that could look like. So that's really, I just want to emphasize, this is a discussion about reasonable accommodation for employees who apply for exemptions from the required COVID vaccine. And so in that case, I will also emphasize, as the rules and regulations evolve, so too will the eligible job titles and roles that can be filled by employees who request the accommodation to waive the COVID vaccine. And I will say again, I'm assuming that the accommodation that's being requested in this example is a waiver of the COVID vaccine requirement. But these roles and job titles I've mentioned today are the ones that we have evaluated and we believe we can make reasonable accommodations for. Now, so what that means, I think the takeaway here is that if an exemption application is submitted and neither the center or a nearby center, so for example, in Louisville, we've got centers that are nearby. If neither your center or a nearby center is hiring for any of these positions for which we can make reasonable accommodation, then there will be no position in which an unvaccinated employee can be safely hired. Hiring an unvaccinated employee into any other position in a skilled nursing facility other than those I just mentioned would not effectively minimize the risk of transmission despite our accommodations and efforts to test, physically distance, and mask. And so the conclusion here is that if none of these positions are currently available, then the request for an accommodation must be denied. So that's the unfortunate, analysis that we'll have to follow. It could be that if we have individuals that would apply for an exemption, we've got some options in those roles I just mentioned. We normally would, or it could be that we don't, just depending on the current status of our team and the workforce. So I'll say again, applications, if you're interested in submitting an application for a religious or medical exemption, I'm now back to my desktop here. I recommend you go to this COVID-19 vaccine FAQ, which can be found as a reminder on the exceptionallivingcenters.com website. And if you go to page 3, that's where the information about medical or religious exemptions can be found. And you can submit those applications to benefits@exceptionallivingcenters.com. If you've already submitted an application, you don't need to resubmit it. And we will be processing those as soon as possible. I've said it before and I'll say it again. I'm sorry that we weren't able to process them sooner, but really we needed to understand the rule, as now I'm pointing back over here to the CMS slide deck. We were not certain until this rule was issued last week whether CMS would allow us to approve these exemptions with, for example, simply what I would call an alternative standard. It was always a possibility that this rule might say, if someone qualifies for an exemption, despite the fact that they have routine direct contact with patients, if they'll just test every day, it's okay. But that's not what the rule says. So because we now understand the rule more clearly and we can see on slide 10, this description about potential accommodations and the responsibility the facility has to minimize risk and the manner in which the guidance has been rolled out, it's more clear to us about how to process the medical and religious exemptions. We'll be processing them soon. It's almost 4 o'clock Eastern time on a Friday. I assure you, you will not receive a phone call today about your application for an exemption, but it will be processed soon. And my hope is that you will hear something next week. So we'll be doing that just as soon as we can. That process will include a discussion with you that our HR team has. They've coached me up this week and helped me understand that that's referred to as the interactive process. So it's not you send us an application and we send you a yes or no answer. There's an interactive process. There's an exchange of information and ideas for us to understand the basis of your application and try to make every effort to provide reasonable accommodation to those who are requesting that waiver. Okay. So I think that's really the trickiest part of the rule, mostly because the rule is so straightforward. The application for the exemptions and the reasonable accommodations can get a little bit tricky. But to move into, some of the conclusions of CMS, again, I can't emphasize this enough. These aren't my slides. This is CMS's slide deck that they've provided, and they're pretty direct. It's obvious they're pretty serious about moving forward with this. They say here, vaccination is the only option. And what they mean by that is something I alluded to a minute ago, that this regulation does not include a testing option for unvaccinated staff. I've always heard that referred to as an alternative standard. And so this rule doesn't allow us an alternative standard. It's get vaccinated, or you can follow the path of the religious or medical exemptions and look for reasonable accommodation. But that's really the path that we must follow at this point. They go on to make it clear to us as providers, under the requirements of participation, that CMS expects to enforce and check for compliance by way of our annual recertification surveys and complaint surveys. And then they go on the next slide to make it clear to us that if we're not in compliance, that they will be handing out civil monetary penalties, denials of payment, and up to and including termination from the Medicare and Medicaid program. Yeah, that's pretty common language as far as the consequences for not following CMS's rules. And they're just describing, frankly, the survey process that many of us are aware of. And eventually, if you don't come into compliance, they will terminate your Medicare and Medicaid provider agreement. So serious business here. I want to come back to what I think is sort of the money slide here. This is really, gives a good visual of really the basics of what is in front of us, that this rule requires a first dose of the vaccine by December 6th and a second dose, if necessary, if we're not doing the Johnson & Johnson vaccine, by January 4th in order to be in compliance. One of the things I wanted to focus on here for a little bit is that, we're attempting to schedule COVID vaccine clinics for all of our facilities. I don't see Mark on. I always like to kick it to Mark here for a few comments. I don't see him on our Zoom. So I'll go ahead and share with the group. I don't know if I'm right or wrong about this, but this is a well-intended effort on my part to try and make this as easy as possible for all of our staff. Should you choose to elect to get the vaccine by the dates that are on the slide here in front of us, I would really like for that to be as convenient as possible. And so we're arranging vaccine clinics for each of your facilities. It's not crystal clear to me what those dates might be yet. I've just toggled my screen over to an Excel spreadsheet where we've got our facilities listed here, and we've got some dates of COVID clinics coming up. So you can see those are November 16th, 17th, 18th, 19th. I know that those dates are a little more in flux than I would like them to be right now as we try to make those opportunities as plentiful as we can. So what I would encourage you to do is, if you elect to get the vaccine, to see someone in your business office and ask them about the date of any upcoming COVID clinic and to sign up for that date. The pharmacies that come to administer the vaccine, you guys probably all know this by now, but they have, when they open a vial of the COVID vaccine, they have roughly 14 doses. And so they really like to have some degree of an understanding in advance before they come out to the center of how many people have signed up and want to receive the vaccine. So that would be helpful. But again, the concept of the COVID clinics at your facility is just my well-intended effort to make this very convenient for everyone. You don't have to leave work. You don't have to worry about any of that stuff. But I think at this point in time, I'm confident in saying that anyone who wants to get a COVID vaccine can find in your area a local pharmacy, whether it's Kroger, CVS, Walgreens, Walmart, to go and get the COVID vaccine. It is free. So whether you go to Kroger or Walmart or get it at the facility, it's free regardless. So don't worry about whether Walgreens will charge you or whether you need to wait and get it for free at the center. It's free either way. Again, I'm just trying to make this as convenient as possible for everyone. I will say, I know I got some information yesterday that there was a crew from Alice Care Center that walked down to the CVS yesterday and got their vaccines. I was really excited to hear that and really can't tell you how much I appreciate that. So shout out to Alice Care Center. And I know there was a team from Parkview that jumped in the facility van, and I think a group of nine folks gassed up the van and went to the closest Walmart to get vaccinated. So good for you guys. That's something you can obviously do. You don't have to wait for the facility clinic. And I would encourage all the department heads and executive directors on here, if you've got a group of people who it would be convenient for them to team up and do something like that, I encourage you to approve that. Let's see here. So just to wrap things up, and we will take questions here, but just to try and kind of put a bow on my comments here today, you know, we've come a long way through just this COVID emergency. You know, we started out just really trying to find information about COVID and inform staff of the risks of COVID. Still remember back when my lovely wife used to make us put the pizza boxes in the oven on 150 degrees for 30 minutes before I was allowed to touch them. And, you know, we were doing some different things back then. You know, we then evolved until we were trying to protect staff through use of masks and gloves and gowns and other PPE. We went through some times where there were shortages of those products and tried to do everything we could to supply adequate amounts of PPE to protect all of our team members. And then we finally started making COVID vaccines available in December and January. I know it was a new concept then and maybe a tough decision to make. We've had vaccines available for going on 11 months now. And you know, during that time, we've provided incentives to staff to get vaccinated through various promotions. We've had incentive programs such as PTO giveaways and drawings for other prizes. And I do want to make sure I didn't have this in my talking points, but make it clear, you know, just because you get vaccinated now doesn't mean you'll miss out on those opportunities. I'll remind our HR team that we need to award anyone who chooses to get vaccinated with that PTO day that we've offered to everyone to help them, you know, feel more comfortable that they have more PTO time if they want to take an afternoon off or the day off, or if they have some side effects, or if they don't and they just want an extra PTO day, that's great too. So at this time, I'm open to suggestions that anyone might have, not necessarily on this Zoom call, but any suggestions to make this easier for any of those who remain unvaccinated. I'm open to any suggestions you may have. You know, clearly we've been given a rule to follow by CMS. We got a warning shot in late August. Now, you know, 75 days later, we've been put on the clock, and we have at this time less than 30 days for all of our employees to have had their first dose. And I hope that everyone can find it in themselves to get comfortable with this decision if you can. And if you can't for any reason, or if you choose not to, I just want to make it clear that I respect that decision and would invite you to come back to the facility to work if that ever changes. We're sort of, as I mentioned, we're on the clock. We're looking at a December 6th compliance date. To continue work uninterrupted, that's absolutely what we need to comply with. But if for some reason, for any reason, you decide to get vaccinated sometime after that, we covered already in this discussion the concept of, you know, full vaccination means that you've completed the primary series of the vaccine and then had an additional 14-day waiting period. If you accomplish that in January or February or March, then I just want to make sure everyone understands there's no hard feelings, and that I would love for you to come back to the facility if you do have a gap in your work with us. So having said that, I think those are all of my comments. Lauren, Ashley, do we have any questions?
We don't have any from this session, but I thought I'd ask a couple of the questions that were asked in the previous. That's okay.
Yeah, let's see if I can answer them better this time than I did the last time.
I think a common question we got in both the sessions today were about the Johnson & Johnson. If someone opts to get the Johnson & Johnson, then just confirming that they need to get their one-shot series done by the December deadline. The December deadline is their deadline to get vaccinated. Is that correct?
That is correct. Yes, well said.
Okay. And then I think the only other question that was asked in both sessions were about a two-part question. One is if a staff person has had COVID in the past, within the last 12 to 20 months, do they still need to get vaccinated? And then a follow-up question to that is if they've had COVID in the last, we'll say 5 to 7 days, and they're within their window to where they're not recommended to get the vaccine yet, how does that affect their deadline?
Right. So the first question of if I've had COVID and maybe there's maybe I've got COVID antibodies as a result, do I have to get vaccinated? I can't pick it out of this 11-page FAQ that you see me looking at right here on the desktop, but it is, I'm pretty sure it's in this one. I've read so many, I forget, but this can be found on Exceptional Living Center's website under the CMS mandate FAQ, and the short answer is you need to get vaccinated. There really is very little wiggle room to getting vaccinated or not in this rule. So I'll leave it at that for that question. The trickier one is if you're coming off of a recent COVID infection, or if you have any other illness of any kind for the moment, maybe I should say an illness that is temporary of any kind, and you are having a hard time complying with this deadline. And so I would encourage those individuals, if you have those questions, to go to benefits at exceptionallivingcenters.com. I know that's an odd website, but that goes to our human resources team. We also have COVID questions at exceptionallivingcenters.com. And so I think those are going to be more individual questions that probably will lead to discussions about temporary leave while you recover from an illness until you can become eligible to get the vaccine. But they may very well also lead to discussions about medical exemptions, and that would go down the path of the reasonable accommodations that we discussed as well. And just frankly, it's complicated, and we want to make sure that we're listening to each individual employee's situation and taking that into account to give them the most options and the best potential course of action.
Great. Those were all the questions I had.
Okay. All right. Well, I will close by saying that Lauren Ashley is going to continue to try and update our frequently asked questions, which again are in this document. You can access those off of this Exceptional Living Center's webpage. And if you have any questions at all, I think some of the easiest places to go for those questions for us is COVID questions at exceptionallivingcenters.com or the benefits at exceptionallivingcenters.com. That doesn't have to be a medical or religious exemption. That can be a question of any kind about this process, this rule. Please do use that so that we can make sure that we're communicating effectively about what we all need to do here to work through this new CMS regulation. So I hope this town hall has been effective, and if you have follow-up questions, please handle them in that way. Okay, thank you, everybody.